I just want to do a quick video just talking about breastfeeding and how I've managed to go for a year. She's just older than a year, and this is to help mums who are thinking of giving up, who just are saying to themselves, this is hard, the baby may not be sleeping and feeding all the time, and this is to encourage women out there to say, you know, you can keep going, don't give up, it will get easier, and it does get easier. And this is my story on how I've managed to keep going and why I've kept going. And yeah, so what I did is I turned around the clock. So we have a clock in the bedroom. I basically got rid of the clock. Don't look at it, because you will only feel rubbish if you look at the time, because then you know that your baby has woken up, you know, 5 or 6 times in the night. And so just, yeah, get rid of the clock, turn it away. So in the few early months, they just want to feed all the time, and I wish that somebody first of all had told me that your baby when they're first born is going to feed all night long and feed all day, but that's completely normal. They're designed to suck, and all that sucking that they do all the time is to make your body produce milk, because the sucking creates the oxytocin, and the oxytocin in your brain has all those good hormones that are coming down to you, coming down to your baby, and it's helping to make you feel relaxed. It's helping all that milk, and the more sucking that they do, which is called so you're breastfeeding on demand all the time with no limits or no limitations, just as and when your baby needs a feed. And it does get easier, but for those first few months, yeah, you're pretty much just feeding all the time. But how I've kept going is I put a poster up in the utility room, which I can show you, and I put posters up around the house, and it just reminds me all the goodness and everything I'm doing for my child. Yeah, just to keep me going. So the first thing, this is these are just some cool facts. Okay, it says here, we all know, this is something that I've printed off. I can't remember what the site is, but it says that human milk boosts the baby's immune system big time, helping baby fight viral, bacterial and parasitic infections, including respiratory tract infections, ear infections, bacterial meningitis, pneumonia, urinary tract infections, infant diarrhea, common colds and flus. Breastfeeding can actually reduce a baby's risk of disease later in life, including okay, don't know, lost that bit, but it says, oh, and it also says including type 1 and 2 diabetes, Hodgkin's disease, leukemia, obesity, high blood pressure, high cholesterol levels, Crohn's disease, ulcerative colitis, asthma and eczema. Breastfeeding reduces mama's risk of ovarian and breast cancer, heart disease and osteoporosis. The longer she breastfeeds, the higher the benefit. In fact, a woman who breastfeeds for 8 years has nearly a 0% risk of breast cancer. Get this, breastfeeding a baby girl actually reduces her lifetime risk of breast cancer by 25%. Breastfeeding saves a family approximately $2,000 to $4,000 annually compared to the cost of formula. Breastfeeding helps mama heal faster in the postpartum, helping her uterus return to a pre-pregnancy size faster and lowering overall postpartum blood loss. Breastfeeding can help mama return to her pre-baby weight. It takes 1,000 calories a day on average to produce breast milk. Women are advised to consume an extra 500 calories a day, and the body dips its reserves it built up in pregnancy to make the rest. It's important to consume those extra calories, or the body actually goes into starvation mode and holds into the reserves. Producing breast milk consumes 25% of the body's energy. The brain only uses 20% by comparison. On average, babies remove 67% of the milk mama has available. They eat until fullness, not until the breast is emptied. Almost 75% of all mums produce more milk in the right breast, whether they are right or left-handed. I didn't know that. Mama's body is constantly making the perfect milk for baby. Milk changes its nutritional profile as baby grows. Milk made for a 3-month-old is different than for a 9-month-old. Milk can even change day to day. For example, water content may increase during the hot weather and baby sickness to provide extra hydration. Human milk contains substances that promote sleep and calmness in babies. Who doesn't love that? Breastfeeding also calms mama and helps her bond to baby. Breastfed infants are at a lower risk of sudden infant death syndrome. Mama's breast can detect even a 1-degree fluctuation in baby's body temperature and adjust accordingly to heat up or cool down baby as needed. This is one reason skin-to-skin contact in the early days is so crucial. Breastfeeding reduces a baby's risk of cavities later on and may lower the chance that they will need braces as kids. Breastfeeding mamas sleep on average 45 minutes more at night compared to those who formula feed. So that is just something that I have on the side, and that helps me keep going, helps me to see that, and so I think, right, I'm not going to give up. And they're also, now I didn't know this, what I forgot to say is also when my first child, he's now 4, he's called Toby, when I was breastfeeding him right from the very start and breastfed him right up until he was just past 2, I became really interested in breast milk, and I wanted to further on, you know, from learning about it. So I did a breastfeeding peer support worker course. So now I have a badge. I don't know where my badge is. And I wear it, so when I go to baby groups around the surrounding areas, mums come and tell me and talk to me and say, you know, I can't, you know, they want to give up, or they're saying that they feel pressured, or they're saying that, you know, it's this latch right, or my nipples are really sore, or, you know, whatever. And I'm able just to talk to them and give them advice. So if there's anything that anybody wants to ask me, or send a video, yeah, do that. I don't mind. Just, yeah, check in. So this says the American Academy of Physicians recommends that breastfeeding continue throughout the first year of life, and that, as recommended by the WHO, breastfeeding should ideally continue beyond infancy. But this is not the cultural norm in the United States and requires ongoing support and encouragement. It has been estimated that a natural weaning age for humans is between 2 and 7 years. Family physicians should be knowledgeable regarding the ongoing benefits to the child or extended breastfeeding, including continued immune protection, better social adjustment, and having a sustainable food source in times of emergency. The longer women breastfeed, the greater the decrease in their risk of breast cancer. They also note that if the child is younger than 2 years of age, the child is at increased risk of illness if weaned. Breastfeeding beyond infancy is the biological norm. The average age of weaning ranges anywhere from 6 months to 5 years. So that's really interesting. And this is another bit that I wrote down from somewhere else. To continue until 2 years and beyond, children who are breastfed in the 2nd year, the milk contains significantly higher concentrations of lactoferrin, lysosamine, and immunoglobulin A, contributing to shorter duration of illnesses, helping the baby fight viral, bacterial, and parasitic infections. And I suppose that makes sense, because at the age of 2, they're putting all sorts of things in their mouths, like, you know, sand and grass and mud, and the extra stuff, the way it changes, is going to help all that. So I'm going to take you with me, and I just want to show you what's in the utility room, which I look at when I can go to the toilet, and it keeps me going when I see this poster. So come this way. Okay, so I don't know which way to turn this round. Perhaps I look at this. So this one here, actually what I might do, I might just pull it off in the wall. So this is the utility room, and the toilet's behind me. So I have this pinned up here, and this one says, did you ever wonder what's in breast milk? So this is all the stuff that's in breast milk. I think there's about over 300 things in there, and this is formula. So formula has a list there. That's what's in there, that's that bit. And this is breast milk, and this here is, in babies breastfeeding, is associated with a lower risk of. So you have a, can you see it? I don't know. There. A list of things. Right, so one more thing. This is out of a really good book, Beyond the Sling. This is by May and Bolick. A definite read if you are into attachment parenting, co-sleeping, etc. Really good, but that's from the book. Okay, so okay, come on then. You on camera? Wave. Hi. Yeah. Can you see yourself on the camera? Yeah. Yeah. You can. There we go. You better have a booby. So applied to cracked or tender nipples, it's one nipple cream you know does not need to be wiped off before nursing again. Squirted into tiny noses on aeroplanes or anywhere germs seek to land and make homes in sensitive nasal passages. The milk provides a coating of the nasal membrane, and a tickle factor encourages sneezing out of said germs. Dripped into eyes with plugged ducts, redness or signs of infection. Check with your paediatrician first to rule out a more serious problem. Used on diaper rash, does not make the tush smelly or sticky. It simply absorbs and works incredibly well. Used on baby acne, heat rash and other skin bumps. Did you know that super fleshy roly-poly babies, even if bathed regularly, can accumulate a very nasty sticky substance in their folds of their armpits, necks and multiple chins and groins? She's saying that her son would get so irritated and the after mentioned sticky stuff would start to crack. So guess what? She put breast milk on it, went away. Dropped into ears during the common cold to prevent the development of an ear infection. Rubbed into ingrown toenails. She waited patiently for weeks as her son's tiny ingrown toenail grew out and for the redness and the swelling to go away. And then she tried breast milk and it healed in a day. That's true actually, because I squirt my milk on Richard's feet because he has dry skin and it just instantly goes. It just keeps them really, really soft. And it also says dabbed on cuts and scrapes. It's a natural antibiotic. Once her son weaned, the older son when it says that she put it onto plasters and then it would make the cut heal much quicker. So that's some interesting facts. Anyway, I really hope if this video helps just one person just to continue, then I've done my job. So I hope this helps. Okay, love you all. Okay, okay, keep going, don't give up, it will get easier. And yeah, put little things around the house just to remind you about how good it is for your baby, and just it will just give you that push that you need just to get through it. Okay, good luck guys. Okay, bye. You say bye. Bye. Yeah, bye. Hi, I just want to add to the video I did last night about breastfeeding, and what I meant was when it gets to, you know, late, 8 o'clock, and you find that your baby is going from one boob to the other, left to the right, to the left to the right, all the time. I spoke about that, and it's just to say that is normal. That is, they're putting in their orders. But one more thing I really wanted to say is, if this helps in those first months, is you have to imagine that your baby is on a meter stick, and imagine just that those first couple of years that you might be feeding for, you know, or a year, think of them on a meter stick and just think how long we live. You know, they're going to live to 100 years old. So feeding just for that short little bit, beginning of life, is a very short time, you know, in the span of how long we live. And if we think about cats and dogs and other mammals, They feed for, I don't know, 8 weeks, I think, but I think they live, maybe the dog has a life of 20 years. So in comparison, when you think about it like that, it's quite a short space of time. And the other thing that might help is, oh yeah, this is a good one. In those first few days and weeks and months when your baby's born, oh, Rich is good. I've lost my train of thought. Oh yeah, sips of drinks. Think how many sips of drinks that we drink, how many snacks, how many meals we have. They have very tiny tummies, so they need to feed constantly to fill their little tummies up all the time. And so if we think of how many snacks we have per day and how many meals and sips of drinks, that should help. Anyway, I hope this helps. And good luck, everybody. And if this helps, again, this just helps one person just to keep going. You know, you're a strong woman and, you know, you can do it. Just keep going. Don't give up. And know that you are pretty much sacrificing everything. You sacrifice your life. Your life is put on hold. And that's okay. And to know that priorities in the house, you have other priorities now that are more important. So forget the dishwasher, forget the washing, just, you know, leave it. It will happen. This is you have different priorities, and just go with it. Let your baby be your lead and stick with it. Don't give up, and you can do it. Okay, thank you for watching, and I hope this helps. Okay, bye.